Inadequate procedures during an occupied healthcare facility construction project can release contaminants trapped above ceilings, behind walls, or under floors, allowing them to infiltrate patient and staff environments via HVAC systems, foot traffic, and other conduits. This is why the Indiana, Kentucky, Ohio Regional Council of Carpenters specifically trains its members in the Infection Control Risk Assessment, ICRA best practices.
The basic principles for the ICRA training are the 16 hours of classroom time and the 8 hours in the shop. So you have a knowledge-based program, the 16 hours in the classroom. Now you've got a hands-on portion, and now you've got your competency-based part of that program as well. The program was developed in partnership with IPs, professionals in the IP world, Andy Streifel and Judine Bartley, who along with the ITC, the International, has created this program to help our carpenters have a better understanding even before they set foot inside that facility. It can be used for occupied spaces, it can be used for food processing plants, pharmaceutical plants, schools.
It teaches the member how to deal with it. And when I say how to deal with it, in other words, how to control where those infections are and make sure that they don't, number one, affect not just the member, but the patient that's in that healthcare facility. You know, we want to be able to keep the doors open of that facility the whole time that this construction is going on. We can control the environment, and it gives our membership a safe environment and that patient a safe environment.
Right now we're in the shop portion, and I've got my group set up. We've got 3 different mock-ups out here where we do 3 different simulations of a hospital environment. My name's Chris Vance. I'm the carpenter instructor here at the Indiana, Kentucky, Ohio Regional Council of Carpenters. Zip poles, which is just a quick, easy way of putting up a plastic wall. Essentially, it's just a very fast, quick job that needs to be done, but we have to protect the surrounding area. Putting up plastic walls keeps everybody to the outside, keeps all of our dust on the inside. You also, it's hard to see inside the middle one here is a cube. Does the same thing. It's just a portable cube that you can roll around, and it creates a little micro environment of cleanliness. The last one is a little bit longer project. It has metal studs and plastic, and all it's trying to do is simulate a clean room environment that's going to be up for a little bit more than a few hours. And then I've got another guy putting on PPE. I have to show the entire Tyvek suit, top to bottom, with the gloves. It's got the hood, it's got the feet, how to tape gloves on. Not only do you have to protect the patients, but you have to protect yourself as well. Last but not least, we have the HEPA units themselves that are running. We'll turn those on, and it teaches the guys how to scrub the air and how to create a negative air environment.
I'm Kay Ryder. I'm the Vice President of Surgical Services for Summa Health System. Part of working in surgical services, obviously we want to do everything we can to prevent infections. As we work with our construction team, it's very important that the work that they do helps to support that as well. The area that I work in, surgical services, obviously we do everything we can do to prevent infections because our patients are at a very high risk. So working with our construction team in any construction phase is very important to make sure that what they do helps to support that.
I'm Lainey Ward, and I'm the Chief Nursing Officer for Summa Health System and over Patient Care Services. ICRA is a very exciting thing for us to embark upon at Summa. You know, as the Chief Nursing Officer, I am focused on our patients and patient safety. And one of those areas of patient safety is keeping our patients from getting infections. Our patients expect to come to our hospital and get better and not get sick. But now we're also going to have other efforts, and that's our contractors and all of our construction projects will also focus on keeping our patients from getting infected.
My name is John Fink. I'm a surgeon, and I'm chairman of the Department of Surgery at Akron City Hospital Summa Health System. Well, anyone who deals in a hospital setting knows that infection control, prevention, and therapy are issues that we deal with every day. I'm very excited that our construction department has instituted a program of infection control and risk assessment and has implemented it in its daily activities. Well, I would think every hospital system would want their contractors trained for the special setting of healthcare. I think this training will raise an awareness that makes a safer environment for all involved. With the implementation of the Infection Control and Risk Assessment Program, we've invested everyone in a common goal. And when you invest everyone in a common goal, things change. Well, many times construction is taking place in close proximity to a sterile environment, for example, the ORs. I think it's imperative that the people involved in that construction be trained to understand what precautions they need to take and have the ability to implement them appropriately. Well, I would think that every hospital would believe and want that the contractors would be trained in the special setting of healthcare. I think this raises an awareness that makes a safer environment for everyone.
I'm Jenny Abel, and I'm the Infection Preventionist Director for Summa Health System. The ICRA-trained contractors are focused not only on their prime work and doing it right, but on the peripheral things like dust generation, dirty shoes walking out into clean areas that affect us in preventing infection. When supervisors, foremen, the staff themselves understand the principles behind preventing infection and how important it is in the work that's being done. So they understand the monitoring, they understand the importance of doing it the same way every time, the consistency of it, and the explanation of why it's important.
My name's Ed Friedel. I'm the Vice President of Construction and Property Management for Summa Health System. A lot of different trades that are going through the training program right now. So our goal is our next major project that Summa takes on, we will mandate certification requirements for ICRA.